Hello, I'm Delia Delore. Welcome to the program. The cost of healthcare rises annually no matter where you live. The Ministry of Health and Wellness recognises this, and plans are underway to move toward universal health coverage to ensure St Lucians will benefit from national health insurance. In this program, I talk to the Permanent Secretary, Felix Hill, and members of the team responsible for the proposal for national health insurance. I also meet a concerned member of the public who asks one of the officers involved with the proposal for answers in the areas that concerns her. Later, I'll be asking you questions and providing their answers, followed by Creole segments with Fennell Neptune. Let's access St Lucia's Health Service right now. Coming up, the Permanent Secretary of the Ministry of Health and Wellness says smart and efficient health facilities are being developed to take advantage of modern health interventions. How the proposal for national health insurance will allow the public to pay for healthcare. Be empowered. How to access your health benefits. But first, a common perception is that as prepayment towards national health insurance creates less net income, it's best to pay for medical expenses when the issue arises. The working concept of national health insurance is misunderstood. The proposal is not approved as yet. When it is, awareness and educating will begin. What are your thoughts about the national health insurance? Do you have any thoughts at all about it? Do you know anything about it?
What I know about it, it's going to benefit citizens quite a lot based on what I know this program is. I hear a lot of talk about it in terms of bringing on board this program, but it is yet to be implemented. I can't wait for the day when it will be implemented because we know the struggles that our people go through in terms of not being able to access, healthcare services. So I am not sure at what stage it is, but I am expecting during my time that it will be implemented. I'm not sure that I know much about it. As I said, a lot of talk, but nothing much has been done concretely about it.
Well, it's proposed for the near future as opposed to the distant future. Mm-hmm. But have you been aware that sometimes that people are not sure about why they should be part of it? Have you heard of that? And what would you say to people who are thinking that way?
Of course, we have a number of people who think that government is just trying to take money from them, and they are not sure that they would benefit. But I know better that if you have a well-functioning, health insurance, it must benefit you. You must benefit from that program. So what I say to them, it's a good program. You need to be part of it. You need to give it the support that it needs so that it can function, well enough. I know persons who probably cannot access the services that are available due to financial issues. So if you have this program in place, it will not be a problem for you. A number of the problems that we face in terms of accessing healthcare would be eliminated. A number of them, not all, but quite a few of them.
Well, thank you very much for your views, Perpetua.
Yes.
And if you'd like to know more details, contact details are at the end of this program. Permanent secretaries are policy makers and shapers. They are responsible for departmental policy initiatives and ensure they are delivered to the satisfaction of the minister. I asked Felix Hill, Permanent Secretary at the Ministry of Health and Wellness, why the ministry believes that national health insurance must form part of St Lucia's health strategy.
Healthcare around the world is becoming increasingly more expensive and could diminish any household's savings and force any household into poverty. National health insurance will reduce the catastrophic effect of healthcare on households' income and considerably reduce the improvising health expenses. Diabetes, hypertension, and other chronic non-communicable diseases will demand growing quantities of integrated quality health care for diseases management to ensure the prevention and treatment of these diseases. And so there is a critical role for national health insurance in the achievement of improved access to health care. We have a number of clinics and services available at the primary healthcare level which are grossly underutilized. A number of people present themselves at the various hospitals for services which are otherwise available at wellness centers. The effect is usually an overcrowded accident and emergency unit at the Victoria Hospital and an unnecessary long wait for patients who could have been served in the wellness communities, in the wellness centers in the various communities at a much shorter time. We are in the process of improving the services within the communities to include more diagnostic services, and I therefore encourage the patients to make greater use of the health facilities within the various communities. The opportunities for training in healthcare are always available. A number of regional and international organizations such as WHO, PAHO, CAFRA, OECS, and many others are always inviting our professionals to training programs and workshops. In fact, it is mandatory that health professionals always avail themselves of continuing medical education in order for them to qualify for the practicing licenses, and that is actually required of the General Nursing Council and the Medical and Dental Council. The nature of the health sector is such that you have no choice but to always keep abreast with the latest developments within the health sector, whether it be for medical care or for maintenance of medical equipment, and the opportunities for training are tremendous. Certainly, St. Lucian citizens will enjoy a much improved infrastructure with the commissioning of the OKEU Hospital and the completion of the St. Jude Hospital. Dennery and Soufrière will see the construction of new district hospitals. New wellness centers will be built in Castries, in Ancillary and Meekwood. And we are now equipping a state-of-the-art laboratory at the OKEU Hospital. And with the advent of national health insurance, we can expect access to health care to be within easier reach of all citizens and also visitors to our shores. We are moving rapidly into further developing an integrated national health system which will deliver a health benefits package which is essentially a minimum socially acceptable set of services that will improve the welfare of all citizens, while preserving the continuity of care that addresses priority diseases and includes health interventions that are of international standard quality and which will be delivered much more efficiently. This, of course, should allow us the ability to contain the country's burden of diseases, especially premature mortality and disability, and considerably improve the wellness of all St. Lucians. Smart and efficient health facilities are being developed to take advantage of the fact that modern medicine offers thousands of health interventions, from actual health care to governance and management issues, and we are poised to take advantage of these opportunities. The strategy to manage these initiatives in light of limited financial and other resources in order to maximize our health objectives must be given due consideration also. The inclusion of all our stakeholders, of course, is of paramount importance in these development initiatives. So while these may seem to take some time, we are asking the public to bear patience and to rest assured that the initiatives which are being undertaken is really for the benefit of all citizens of St. Lucia.
I have a question for you now, with the answer provided right afterwards followed by the Creole segment with Fennell Neptune. Question. Primary care clinics and services are grossly underutilized. True or false? Answer. True. A number of people go to hospitals instead of wellness centers and clinics, and this causes overcrowding at accident and emergency units.
Secrétaire permanent ministère de santé n'y a pas pour jouer à de policy santé qui gouvernement a mis en place, spécialement ces différents projets santé. Yo sini pour assurer que ces projets santé yo ka délivrer cette liste yo satisfait pays. Secrétaire permanent monsieur Felix parlait qui service santé yo ni avec la bay cette liste. Yo aussi parlait du côté k'ay vle ou affaires santé et qui ka vini.
Nous avons en bonne quantité clinique et services qui a point court dans ces différents wellness centers ou en pays. Avec moi que mon pas qu'à servir ces services là assez. En chaque monde de les qu'a venu Victoria Hospital avec plein d'institutions pour demander services qui ont ça joindre dans ces différents wellness centers qui ont pays. So nous ka dit c'est mon ça là en chaque commune ni pour faire qu'on yo connaître qui ça qui est available en dit dans ces communes ça avec si mieux vini Victoria Hospital avec pendant bonne quantité de temps yo ça aller dans ces communes ça ces wellness center différentes communes là avec jeune service ça la plus aisé plus vitement. Well, de manière nous ka travailler en ministre santé à présent. Là qu'il y a une bonne quantité d'improvement en ça nous ka créer infrastructure. So en bonne quantité infrastructure neuf kay monter nous ha ça OKU Saint Jude ça c'est l'hôpital neuf qui a débattu. Dennery avec Soufouye kay joindre ça nous ka créer district hospital, ça a venu tout niveau. Et en bonne quantité wellness center. Nous avons fait ça, nous avons créé smart hospital et puis assistance paro. Avec nous avons also rebâti Castri en Slawi avec Miku. Là, il y a wellness center qui est tout niveau. Et moi, ça doit puis assurance santé, nous avons implémenter accès là manière mon kay ça rive joindre ces services santé ça là il est much plus aisé pour eux.
Yon démarche neuf qui a joué gros pas à la direction santé pays, c'est assurance santé, ça veut dire National Health Insurance. Monsieur Felix parlait de l'importance des démarches ça là.
Assurance santé ka vient plus cher pour tout le monde au en la terre. Includé pour Saint-Lucien. Bon, il y a des cas santé pour ça dépenser en l'argent ça fait en famille venir très pauvre. So il est nécessaire à présent pour le gouvernement ça implémenter en qualité assurance santé qui mène en manière plus aisée pour toute la famille joindre accès pour santé.
Est attaque qui a venu, ministère de santé qui a mis un chaipez à sauver bâtiment l'hôpital et place santé au pays. Et oui, B non. Réponse là c'est oui. Ministère de santé j'ai commencé travail à sauver plusieurs places santé au pays.
Within the Corporate Planning Unit in the Ministry of Health and Wellness is a team whose main purpose is to produce the proposal for St. Lucia's National Health Insurance. One of the main aims of the NHI is to allow people to reduce their immediate out-of-pocket costs when they have to pay for healthcare. Explaining the system and its importance, here's Lauren James.
Basically, a financing system that will make sure that St. Lucians have access to an essential basket of services while ensuring that there's a sustainable financing for delivering those services to the people of St. Lucia. And basically we have recognized that persons do not access healthcare when they need to because they do not have the necessary funding. So as well as that we have recognized that the health system requires adequate financing to deliver those services. So basically, this initiative is looking at a balancing of those two needs, both on the population end and the provider end. Basically, the NHI, the acronym we use, it has three basic objectives. One is to really provide people with equitable access to a basket of health services. When we speak of equitable, we mean all individuals, regardless of your income level, where you work, your gender, or wherever you are from St. Lucia, that you have access to these basket of services without any discrimination. The other objective of the NHI is to reduce out-of-pocket payments. We have recognized that this is one major barrier to persons accessing healthcare when they need to. So basically, the person with diabetes who doesn't know, it's only when it's too late that they come to the health system, and then that is when it's more expensive to treat. So basically, we want to mitigate against that persons have access and that we curb this cost to the health system. As well as that we need, in order to provide those services, we recognize that there is a need for an adequate pool of financing for the health system. We cannot do all that with just a limited amount of money. We need adequate and sustainable financing for the health system. So those are the three: that we provide equitable access to health services, that we reduce out-of-pocket expenditure, as well as create a sustainable pool of financing for the health system. This initiative we expect to impact the provider in terms of that we improve health outcomes through the availability of this package, that persons are able to access preventative, health promotive, as well as management services for the condition. So in that regard, we have better health outcomes and we reduce the cost to the health system. As well as with more financing, that we are able to implement our quality standards, that persons have a certain quality of services that they will access. To be honest, the corporate planning unit has been working assiduously on this initiative for the past few years. We have had, the public really doesn't know about it, but we have had many achievements in this regard. We have already defined a package of services with our stakeholders that included doctors, nurses, and different healthcare providers, and also private sector. And we have this draft package of services which has to be reviewed given the time which have elapsed during the formation of that package. We have also had assistance from the EU in terms of looking at financing mechanisms, looking at different modeling to estimate the cost of the NHI. We have had the EU as well looking at the different the roadmap, like the different structures that we have to put in place in order to get to the full implementation of the NHI. Right now, because of all the groundwork that we have done, we have secured 20 million USD in funding to implement those structures, to generally implement NHI. And that World Bank project is expected to look at the structures that we have to implement for NHI in terms of your health information system, your legislation, your quality standards, your standard operating procedures, as well as improving our infrastructure, our equipment on the supply side of things. Also, I think that we have partnered with the Ministry of Finance to look at the best way of financing that package, so that it is something that is easily that that when it's time to implement that, they'll be buying from both finance side and the different stakeholders. So hopefully in the coming few months, we will be having more stakeholder engagement in terms of our NHI. A lot of our health outcomes are a result of persons not accessing timely care. And we all know the reasons why, that if a mother who has 5 kids and who has to basically make ends meet, her health won't be a priority. So by health being prepaid, like when persons want to access health, that they have the option of just walking into the hospital and just order health centers and just accessing healthcare. So that basically all those end-stage diseases, we wouldn't have to deal with them. It is more cost to the health system that way. Once we prevent those from getting to the end stage, we would have our goal of really curbing healthcare and basically having better health outcomes to our people. We also have to highlight that NHI will come at a cost. It is not free. But basically the whole concept is to have health prepaid, which is basically what private health insurance and everything aims to do, so that when you need the service, that you would not have to pay that huge cost. Okay? So that is really the importance, that persons are able to get preventative care before it's too late.
The proposal for national health insurance has 3 basic objectives: provide equitable health services, reduce out-of-pocket payments, and have a sustainable pool of financing. Answer: true. These 3 elements form the base structure of the national health insurance.
Adeda unit corporate planning, la aussi ni a team qui ni responsabilité pour mettre en place plan pour asseoir santé pour cette liste sable di National Health Insurance. Objectif asseoir santé ça là, c'est pour bailler cette liste opportunité pour payer moins pour préca santé yo. Yo si ka assurer ki cette liste ni différents services santé available. Demas ça là kay aussi bailler organisation qui ka poursuivre service santé opportunité pour délivrer un bon service by cette liste. En même temps, asseoir santé ça là, kay bay cette liste opportunité pour préca santé yo plus bonne. Yon officier qui responsable pour plan santé au ministère, Mme James, parlait des achievements yo a unit corporate planning. Il dit qu'il y a plusieurs années depuis yo ka travail à sous démarche asseoir santé. Il dit qu'il y a un effort pour garder qualité service là yo kay offert membre public là. Yo aussi ka chen meeting epi docteur, nurse et l'autre membre public et privé hot secteur santé. Mme James dit qu'il et puis assistance l'Union européenne, yo te sa mette un système en place pour assurer des démarches assurance santé implémentées et ka aller en bonne direction. L'Union européenne aussi aide yo pour déterminer pour assurance santé. Démarche National Health Insurance, c'est un projet de Banque mondiale, ça c'est World Bank. Le gouvernement aussi recevrait 20 millions l'argent américain pour implémenter des démarches salaires. S démarche neuf la, National Health Insurance, kay bay cette liste chance la pour payer moins pour préca santé yo. A, oui, B, non. Réponse là c'est oui.
At the Ministry of Health and Wellness's Corporate Planning Unit, social planning is key. So as part of the proposal for national health insurance, social and financial factors are researched. More about this from Social Planning Officer Jackie Mills.
One of the main policy thrusts of the ministry has been to improve access to care. Notwithstanding many of the achievements that we have made in terms of infrastructure, development of new programs and new policies and legislation, we still found that there are still some barriers to care in terms of persons are not accessing especially the primary healthcare services, by which I mean the services offered within our health centers. And what we end up seeing is like when they come to our facilities or the hospitals when it's really too late and we then have to focus on treatment of the diseases. The World Health Organization has defined health as not just the absence of sickness, but also a more holistic spiritual and physical well-being. With that, the role of the social planner within the Ministry of Health becomes even more important. In terms of, we are not just treating the traditional health illnesses, but we now have to look at what are those barriers that that can challenge persons to access our health facilities, what we call the social determinants of health, as well as the environmental determinants of health. When we looked at your top leading causes of death and even the burden of disease in terms of our chronic illnesses, the interventions that we really aim to have an impact, and they don't just traditionally lie within the Ministry of Health. You have to look at persons' the socioeconomic status in terms of the earnings and how it is being spent. You have to look at the person's level of education, which can affect how they interpret their health status and how they interpret access to care and stuff like that. So it is more looking at persons' social and environmental factors and how those things lead to them not accessing care when they really need to. In terms of one of the most important initiatives that we are doing now is the implementation of the NHI. And when we look at the NHI, what we aim to do is to reduce the out-of-pocket expenditure where persons have to pay for their health care at the time of accessing. So one of the most important initiatives that the ministry is now pursuing is the rollout of the NHI. And that really seeks to provide persons with a basket of services really focused at keeping people well. And that basket, we envisage it to be very holistic in terms of your mental health, your physical health, looking at the social, taking into account your social status as well, your social and educational level, and how we tailor those programs to meet the needs of the population. With that, we have main principles of social justice. We want our services or the package or whatever that we provide to the public to be appropriate, to be client-focused, and as much as possible, and of course, affordable to the public. When we speak of client-focused care, we also want to ensure that whatever we do, the client is at the forefront of, is in the middle of it, and we want to do more of an engagement in terms of ensuring that we are not the ones just providing care for them, but how do we have programs and engage them as well, so they now become empowered and they become part of this care that we are providing for, not providing for them, but with them. When we look at your chronic non-communicable diseases, we also have a high level we also have to depend heavily on the client to do their part, whereas we can provide the Ministry of Health can provide the medication. We can work with other agencies such as agriculture, education to provide that. But the client also has a very important part to play in the management of their condition. As we roll out the National Health Insurance initiative, we really want the public to be patient with us. It would definitely require a change in how they access care, where they access care, and what exactly it is that we aim to provide to them. We hope that we can mitigate against that in terms of long waiting times, and by just letting them know and engaging them as we finalize this project and as we roll it out. At every stage that we will engage them to inform them of what exactly is happening, and as much as possible provide a map of the system so that they know how to access and where to access services when they need it.
Question. The proposal for national health insurance aims to reduce the out-of-pocket expenditure when people have to pay for their health care. True or false? Answer. True. The proposal for national health insurance takes into account that the public may not have funds to access healthcare when they need it, and the ministry also recognises that the national health system requires adequate financing to deliver those services. The proposal for national health insurance balances these two needs of the public and the government.
Ada effort pour implémenter plan pour asseoir cette lesi. Unit Corporate Planning te aussi ni pour garder ces problèmes sociaux et finances, moun ka experience le yo bouze service hot se faciliter santé à pays. Unit Corporate Planning aussi ni responsabilité pour faire recherche sociale et puis ka garder qui ça la vie moun et bien environnement qui ka empêcher yo joindre ka santé. Yo officier qui responsable pour plan social unit ça la Mademoiselle Jackie Mills dit que c'est pour raison salarié important pour encourager cette lycée pour prendre opportunité ces services santé qui avaient là. Mademoiselle Jackie Mills dit qu'il a des efforts pour assurer des marches assez santé sur succès les implémenter. Yo aussi voulait assurer cette lycée joindre assez information à sous santé yo et savent qui côté pour aller joindre service santé. Ministère de santé ni espoir qui membre public là kay ni chay patience quand yo fait changement à demander moun kay recevoir service santé. Quand ministère de santé ka travaille pour implémenter des marches à sewa santé qui des problèmes yo ka considérer. A. Social et général. B. Social et finance. C. Finance et physical. D. Physical et social. Réponse là c'est social et finance.
I was so impressed by how inquisitive Mrs. Perpetua James from Dennery was when we discussed the proposal for national health insurance earlier in the programme that I invited her to meet the lead for the proposal for national health insurance. One of her questions was, do you know the difference between NIC and NHI? Do you? Thank you, Lauren and Perpetua, for being part of the programme. Perpetua, let's start with your first question for Lauren.
I would like to know what the basic differences are between the NIC that's already established and the proposed NHI project.
Okay. The NIC, as we know, is basically a pension fund with very limited health benefits. For example, the NIC, they would pay you if you get injured on the job, they would compensate you for that. If you're out of work, they would compensate you for the time spent out of work because of sickness. And they also make a contribution to Ministry of Health with regards to their contributors. But in the case of if you fall ill, you have something, for example, like cancer, where you would have to go through different tests. You would not present that bill to NIC now, would you? And that is basically what the difference is between the health insurance and NIC. Our proposed NHI is actually a health insurance, but at a national, more public level, where you contribute to a fund, and there's a specified benefits package that you are entitled to, which we will cover when you have to. And that is the difference between, because as you know, NIC, about 80% of their portfolio is pension, and the rest is just some health benefits. Okay.
So Lauren, can I ask you something here? So is NIC still going to be there when NHI comes?
Yes, it is.
Because I think a lot of people are thinking that the NHI is going to replace the NIC. Am I right, Perpetua?
The general thinking, and that is a real concern for some persons. And you said that the NHI would cover, it becomes more public,
Yeah.
But how public? Who would benefit? Who are the beneficiaries?
Every St. Lucian. It is intended for every St. Lucian. As long as you legal in St. Lucia, you entitled to it. Right? And once you are registered, you are entitled to the package of benefits.
So you mean whether you are a member of the working population?
That's correct.
You are an elderly person?
That's
you
correct.
benefit from that program?
That is correct.
So how do you contribute? How does one contribute to that program?
Well, the thing is that right now we are working out that detail at the ministry level with Ministry of Finance and Health as to how we are going to contribute, whether it be through a premium payment, whether it be through a tax on, let's say, for example, VAT, or through an increase in the NIC. We have not worked out that detail yet, but it will be a mechanism where everybody will have to contribute into that health fund. So that when you come to the hospital or the health center, you will not have to take money out of pocket to pay. It's already prepaid.
Yeah.
Yeah.
But my concern is I would like you to be a little clearer on the premium payment, if that's one of the mechanisms you're going to use. How is that going to happen?
But like I said, that we have not worked out that detail yet, because right now it's at the level of Ministry of Finance and Health as to how we get the payment going, whether it be out where somebody pays a premium or whether they put tax on, say, for example, just for argument's sake, on VAT, or whether it be a tax on people's income. We have not worked out that part yet.
Okay.
Yes.
So the public will be made aware
Yes.
At a later date.
Yes, because right now, as soon as we have decided, the public will be consulted on that aspect.
Yes. So the other thing is, we know all insurances, there are limitations. They don't cover everything. What would be the services that the NHI covers?
And you are correct that it is limited. And even with an NHI, it would be limited because there is only so much money that we will be able to collect. So if in a perfect world, we would like to include everything from cancer to diabetes to end-stage renal failure. We would like to do that, but the fact is that money is limited. So we have to look at really what is really most pressing for our population and decide on what benefits will be in that package. Right now we have defined one, but we are working with a consultant now to kind of narrow it down to make it more affordable for the government of St. Lucia. Yeah, so it would include primary care as well as secondary care. Preventative, where we encourage people to take be proactive with their health, to go screening and do everything necessary to prevent them from getting sick. As well as when they get sick, we have something in place for them. But as to the details, we cannot really outline it fully until we have finalized that consultancy.
Okay, so you were saying that there are a number of areas that the NHI will cover?
Yeah.
In terms of those diseases that are very prevalent?
Yeah, for example, diabetes, hypertension, we have recognized that those two are actually one of the most prevalent diseases in St. Lucia.
Okay, so isn't that covered now by the
Yes,
NIC?
actually,
Are these covered by
not
the
NIC
no?
actually. Actually, that was the first phase of the UHC pilot. We had a whole, maybe over 10 years ago, where we provide medications free for diabetic patients and those persons who have hypertension with diabetes. And it's still going on. We provide free medication for those people.
So based on the conversation you've had with the policymakers, you think it would be affordable? When I say affordable, I mean, you know, not too much to be taken from the general public.
I don't believe so. Because it would be everybody contributing to that fund. So, in other words, it wouldn't be too much of a burden on one person because everybody contributes.
Yes, so these are the main concerns that I'm hearing, and I have myself. So I'm hoping that this program. In fact, I know if it is implemented, it would help some persons, but persons really need to know.
Yeah, and it's very important too because a whole lot of people now It's because they don't have money. They don't go for screening. For example, my dad, he died of cancer. It's because he put his family first. He never went for a screening. And eventually, when they diagnosed him with cancer, it was too late then. So I think it will help a lot of people in Africa from preventing us from going to the more expensive part of healthcare.
So my last question would be something that's very troubling to me, because I've had a lot of situations where persons, in fact, recently I was told that a lady, she told me she spent 6 weeks in a wheelchair awaiting treatment until she was amputated. She came in for some condition that she had, and she waited for 6 weeks. Will the NHI address these concerns in terms of, you know, the issue of beds and so on? Would the NHI cover this?
Yes, because right now we have received funding from the World Bank in the tune of 20 million USD, which is about 53 million EC, which will implement NHI as well as strengthen primary care, right? And also, when we strengthen primary care, we are hoping that most of the conditions that we are seeing at secondary care, that it will be reduced, so it puts less pressure on the secondary health care, and then it will be more efficient in that way. So hopefully, when we transition into Owen King, and we have more sophisticated equipment and everything, it will get better in terms of our primary care management, where people get sick less often, and secondary care, where we have our new hospital when St. Jude comes on stream, and when our primary care is beefed up, it will get better.
Okay. Is there any date for implementation of the NHI based on your discussion?
Well, we are hoping to have a first phase in January of next year, but the full thing would take a while because you'd have to have registration of the population. You'd have to have all the structures in place before. But hopefully we have a first phase in January to just test to see how it will work.
Perpetua, thank you very much. You've summarized everything that I'm sure lots of St. Lucians wanted to hear those answers to. But how would you now encourage the members of the public that it is something that they should consider? Because after all, we all know that when you're trying to survive and you have to make deductions in order to put it somewhere else, it's difficult. How would you encourage people in your community that the NHI is a good thing they should consider?
Well, based on the information that I gathered today, and I added it to what I already knew, I would definitely ask persons to be part of this program. You know, it is going to be so much better in terms of access and healthcare. Without that, I don't think a number of persons would be able to pay for the medical services that they would need. You know, because we have so many illnesses that require a lot of funds, a lot of funding. And the private funds, your private funds would never be able to go that far. So I would definitely encourage our persons, our individuals, our citizens to be part of this program. I'm sure it's not going to be too much, you know, and they would be better for it.
And I think the other thing people need to consider, because of course when healthcare is needed, there are other things in life that need to be seen to. And then you start juggling. But if you're part of NHI, at least that's one that's a little less that you have to think about getting all the money for. Is there anything else that you think that the public should be aware of, you know, based on the questions Perpetua asked?
Well, one thing that that stands in my mind is that when she said about the person who waited 6 days, right? It's just that the ministry, the government of St. Lucia has been putting so much money into healthcare, approximately 130 million a year. And we only recoup about 10 million in health. So this health insurance will actually bring more money to the health, so that we could improve on the service that we provide people. Because we don't really collect revenue from services that we provide, because most persons cannot pay for it. That is why we are limited in what we do. So by having this fund, we'll have more money available to provide the services that the people need. And that is my final word on,
Well, thank you both very much for being with us.
À présent, nous avons une petite discussion et puis Perpetua James à sous démarche neuf la National Health Insurance. Ça veut dire assurance santé pour pays. Bonjour Perpetua James.
Bonjour.
Ou te une discussion et puis Lauren James qui se travaille au ministère de la Santé et qui a joué par de direction de démarche neuf là. Ça c'est National Health Insurance. Et puis, vous avez une question, différentes questions qui concernent vous. Il y en a de ces questions, c'est qui différence là de National Health Insurance là et puis NIC. Est-ce que ça dit nous, est-ce qu'on y a plus mais là qu'on prend des démarches neuf ça là?
Discussion moi teni avec jeune madame na plus bonne. Il fait me comprendre NIC avec NHI là, il y a des différents projets. NIC a couvert certains monde qui a travaillé, qui a fait contribution et qui a couvert certains bagages à la vie, comme pension avec certains malades, cas maladie. NHI là, qui a couvert tout le monde dans la population. Ou vieux, ou petit, ou jeune, ou qui travaille ou pas travailler. Et qui a couvert un chai de fonds en bagaille. Pas toutes, mais en bonne quantité. So, mon comprendre ça, à ce NHI là, quoi, il a couvert une grande population cette lycée.
Mais est-ce que tu joues un plus mais la comprendre qualité service là, mon qui sa joindre hod démarche neuf ça la National Health Insurance.
Oui. Parce que NHI là, nous avons une manière pour faire moun qui contribue plus moun qui fait contribution yo. Quand le gouvernement a plus ressources pour mener plus service by ces mona. Quand il a bénéficié mona because plus moun qui couvert actuellement on y a chaque moun qui a helé. Yo pas ça même aller en certain hôpital puis yo pas payer l'argent. Bon c'est ça NHI là qui a été pour empêcher. Yo voulait presque tout le monde en pays a. Garder côté yo ça un bénéfice en projet ça.
Ou parler des bénéfices des machines neuf ça là. Quelle manière ou ka encourager résidents en commune pour faire service démarche neuf ça là, National Health Insurance, NHI.
Quoi, moi, do plus monnaie à chaque monde qui a helé. Bon, si vous avez helé, on est pour regarder pour comment y est là qui vient plier. So, ou ka helé, ou pas l'assurance, ou pas insurance. Quoi, comment vous avez fait garder? Insurance ça là, c'est insurance qui pas cher. Pièce côté en la terre, National Health Insurance pas cher. Quoi, on est pour regarder pour faire une contribution. Pour mettre en fond ça, en l'eau fond ça, pour l'eau malade, ou pas ni mal tête ça là. Ou mon cahier encourager pour accepter. C'est pas là yo ka été en poche n'importe manière, mais c'est pas un chat là yo ka été en poche. So accepter avec ça gouvernement ka venir et puis yo ka pour payer un timiette en ça ou ka joindre si c'est un bagage ou acheter, si c'est un what qui manière yo kay fait là il pas kay affecter ou je et ben ko kay un bénéfice pour un docteur pour aller docteur pour aller l'hôpital pour un bénéfice ça yo ka qui health services.
Merci Ashay.
Merci madame.
From talking to the policymakers to talking to the public, I hope this program has provided information that encourages you to find out about the health services available to you. Have discussions with family and friends about the National Health Insurance Initiative. Don't forget, when you're sick, the absence of funds is stressful, makes the ailment worse and becomes more expensive to treat. Remember, prevention is better than cure. See you next time when we discover more about the services and improvements to our health service. Goodbye.